Gout, the fiery pain you shouldn't ignore. Symptoms, causes, and smart treatment. Imagine being woken up in the middle of the night by a burning pain in your big toe. It's red, swollen, and feels like it's on fire. You didn't twist it, you didn't bump it, but it feels like something serious is going on. This, my friend, could be a gout attack. What is gout? Gout is a form of inflammatory arthritis. It's caused by an excess buildup of uric acid in the blood, which forms sharp crystals in the joints. These crystals trigger sudden, severe pain and inflammation. While it most often affects the big toe, it can also impact ankles, knees, elbows, wrists, and fingers. Gout has been known since ancient times and was once called the disease of kings because it was associated with indulgent diets rich in meat and wine. Today, we know that it can affect anyone, regardless of royalty. Early warning signs. Recognizing gout symptoms. Gout symptoms can be sudden and intense. Here are the most common and early warning signs. 1. Sudden joint pain. The hallmark of gout is an abrupt and intense pain, usually starting at night. The pain can become unbearable within a few hours. The big toe is the classic target, but other joints can be involved. 2. Redness and swelling. The affected joint becomes red, swollen, and warm to the touch. It may look infected. 3. Tenderness and sensitivity. Even the slightest touch, like a bedsheet, can cause excruciating pain during an attack. 4. Limited range of motion. As the attack continues, the joint may become stiff and difficult to move. 5. Lingering discomfort. Even after the worst of the pain is over, the joint may feel uncomfortable for days or weeks. What causes gout? The root cause of gout is hyperuricemia, a condition where there's too much uric acid in the blood. Normally, uric acid dissolves in the blood and is eliminated through the kidneys. But when the body produces too much or excretes too little, crystals form. Risk factors for gout. Diet high in purines, red meat, seafood, organ meats. Alcohol consumption, especially beer. Sugary drinks like sodas. Obesity. High blood pressure. Kidney disease. Certain medications such as diuretics. Genetics, family history of gout increases your risk. Gout attacks. What happens during an episode? A gout attack is often described as one of the most painful experiences. The pain usually comes on suddenly, often during the night. The area becomes swollen, hot, and extremely sensitive. The attack can last a few days to a week if untreated. Recurrent attacks can damage joints and lead to chronic gout. Gout progression. 4 stages you should know. 1. Asymptomatic hyperuricemia. High uric acid levels but no symptoms yet. 2. Acute gout. Sudden, painful flare-ups of inflammation in one joint. 3. Intercritical gout. The time between attacks when there are no symptoms but uric acid is still elevated. 4. Chronic tophaceous gout. Long-term gout that leads to permanent joint damage and tophi, large crystal deposits under the skin. How is gout diagnosed? Doctors often diagnose gout based on physical exam of the swollen joint, medical history and dietary habits, joint fluid test to look for uric acid crystals, blood tests to check uric acid levels, imaging such as ultrasound or dual energy CT scan. Treatment: how to treat gout and prevent future attacks. 1. Medications for acute gout flares. NSAIDs like ibuprofen or naproxen to reduce inflammation. Colchicine, a specialized anti-gout medicine that reduces symptoms if taken early. Corticosteroids used when NSAIDs can't be taken. 2. Long-term uric acid lowering therapy. Allopurinol or febuxostat reduce uric acid production. Probenecid helps kidneys remove uric acid. Important: long-term medications are not started during an acute attack but after symptoms subside. Lifestyle and diet changes to manage gout naturally. Gout is not just about pills. Lifestyle plays a big role. What to do? Drink plenty of water to flush out uric acid. Maintain a healthy weight. Choose low purine foods like vegetables, whole grains, and dairy. Exercise regularly. Manage blood pressure and other health issues. What to avoid? Red meat and organ meats. Seafood like sardines and shellfish. Alcohol. Sugary drinks and foods rich in fructose. Natural remedies that may help. Some natural foods and supplements may support uric acid reduction. Cherries or tart cherry juice, anti-inflammatory properties. Vitamin C helps lower uric acid. Coffee, surprisingly associated with lower gout risk. Magnesium helps reduce uric acid in some people. Always talk to your doctor before starting supplements. Can gout come back? Yes, without proper management, gout can become chronic. Repeat attacks can damage joints permanently and reduce quality of life. But the good news? Gout is one of the most treatable forms of arthritis. Interesting gout facts you might not know. Gout was described as early as 2600 BC by the Egyptians. Leonardo da Vinci and Benjamin Franklin both suffered from gout. Some people with normal uric acid levels still get gout. Gout can mimic infections and other types of arthritis. Final thoughts: take gout seriously, but don't panic. Gout may seem like a minor inconvenience at first, but repeated flares can be debilitating. The good news is that with the right treatment and lifestyle changes, most people live normal, pain-free lives. If you or someone you know experiences symptoms like sudden joint pain, especially in the toe, don't ignore it. Get checked, talk to your doctor, and start a plan to take control. Your joints will thank you.